Before every major surgery, anesthesiologists run through their checklist one final time. Medical history, weight, blood pressure, allergies, and quietly, almost without drawing attention to it, some of them note one more thing: eye color. Not because it looks good on the form, but because it affects how much medication you actually in. Most patients never hear about this. Most doctors never explain it. Yet this research has been sitting in medical journals for years, waiting for someone to ask the right question. Today, we're asking it. I want you to stay until the end, because somewhere in the middle of this video, you're going to learn something about pain thresholds that will permanently change how you see operating rooms, medical systems, and your own body's limits. Let's start with something that happened in an operating room. A patient goes under. Standard procedure. Standard anesthetic dose. But the patient wakes up too early. Not fully. Just enough to feel. Just enough to remember. The anesthesiologist steps in and increases the dose. The surgery continues. Patients with light-colored eyes, blue, gray, and green, were waking up earlier, requiring more sedation and reporting higher levels of postoperative pain. And this wasn't happening in one hospital. It was observed consistently across multiple hospitals, different surgeons, and different countries. This was not an error. It was biology. So what is actually happening inside your body? You already know that eye color comes from melanin. More melanin means darker eyes. Less melanin means lighter eyes. But melanin doesn't only live in your iris. It's distributed throughout your entire nervous system. And in particular, it concentrates in a region deep inside your brainstem called the locus coeruleus. The locus coeruleus. Say it slowly. Because this small, dense cluster of neurons is one of the most powerful regulatory centers in your entire brain. It controls your stress response. It manages your sleep cycle. It regulates how your body processes pain signals. It is packed with melanin. This is not cosmetic. This is your brain's control room. The amount of melanin inside it appears to be directly linked to the melanin in your eyes. Think about what that means. The color you see when you look in the mirror is not just a genetic coincidence. It may be a window and a doorway into how your brain experiences pain, stress, and the full range of physical sensation. Now let's go deeper into the research, because this is where things get truly interesting. A 2021 study examined women during childbirth. Pain tolerance, anxiety levels, and post-delivery recovery were all assessed. The results were striking. Women with darker eyes reported significantly lower pain intensity during labor. They required less epidural medication, and their recovery scores were higher. Women with light eyes, particularly blue and gray, showed measurably greater pain sensitivity across every single metric. This was not a coincidence. Researchers eliminated variables one by one: age, body mass, prior birth experience. The result held. Eye color was an independent factor in how pain was experienced. And now I need to ask you something directly. Do you live with chronic pain? Or do you know someone who has tried everything, and nothing ever seems to fully work? Write it in the comments, because the rest of this video is exactly for them. Let's go even deeper. Because the pain threshold story is only one part of what melanin is doing inside your nervous system. Melanin in the brain is not just structural, it's functional. It plays a direct role in the production and regulation of two of your body's most critical neurotransmitters, dopamine and norepinephrine. Dopamine manages your reward system, your motivation, your sense of well-being. Norepinephrine manages your alertness, your stress response, and critically, how intensely you perceive pain signals. Individuals with darker eyes and higher melanin concentrations in the locus coeruleus appear to produce and regulate these neurotransmitters more efficiently. The system runs smoother. Pain signals are processed, acknowledged, and dampened more effectively. Individuals with lighter eyes have less melanin in that same region. The regulation is less efficient. Pain signals travel through a system with fewer buffers. More gets through. More is felt. This is not weakness. This is not sensitivity as a character flaw. This is pure neurochemistry. Your nervous system is running exactly the software it was built with. The only question is, do you know what software that is? Now things start to get even stranger. Honestly, a little unsettling. Alcohol sensitivity follows the same pattern. Multiple researchers have found that people with lighter eyes show a measurably higher sensitivity to alcohol. They experience stronger effects from smaller amounts. They report more intense physical reactions. and some studies suggest they may carry a statistically higher vulnerability to developing alcohol dependence over time. The proposed mechanism is the same. Melanin in the nervous system appears to influence how quickly your body metabolizes substances that affect neurotransmitter function. Less melanin, less buffering, stronger reaction. The next time someone calls themselves a lightweight, consider this. They might not be exaggerating. They might be describing their own neurobiology with more accuracy than they realize. And I want to pause here and ask, have you ever heard any of this before? Has a doctor ever asked you about your eye color? Write it in the comments. I'm genuinely curious. Now let's talk about what happens when this research reaches the medical system. Or more accurately, what happens when it doesn't. Pain management is one of the most underfunded and most misunderstood areas of modern medicine. Patients with chronic pain are routinely undertreated. Their reports of pain intensity are frequently met with skepticism. And statistically, a significant portion of those patients have lighter eyes. There's no suggestion here that eye color is the only variable. Pain is complex. It involves psychology, history, inflammation, nerve damage, and dozens of other factors. But when a patient with blue or gray eyes tells their doctor that the standard dose isn't working, that they're still in pain, that something feels wrong, and the doctor has no framework for understanding why that might be biologically true, that patient leaves undertreated. The research exists. It's published, it's peer-reviewed. But the distance between a journal article and a clinical protocol can be measured in decades. This is why knowing your own biology matters, not to self-diagnose, not to override medical advice, but to walk into that conversation with your doctor carrying something real, something you can point to, something that says, this is not in my head. This is in my nervous system. And here's the part that may change how you look at your entire history with pain. Every time you felt pain more intensely than the person next to you. Every time you needed more medication for the same procedure. Every time someone told you that you were being dramatic, overly sensitive, or anxious about a medical situation. Every single one of those moments may have had a biological explanation that nobody ever gave you. Your pain threshold is not a measure of your strength. It is not a measure of your character. It is a readout of your neurochemistry. And that neurochemistry, just like your eye color, was written into you before you were born. Coded in the genetic inheritance of people who crossed continents and survived ice ages to bring you here. The person who winces at a paper cut and the person who barely notices it are not displaying different levels of toughness. They may simply have different concentrations of melanin in a cluster of neurons deep inside their brainstem. If this video has been useful to you, take a moment and follow this channel. Because this isn't just a channel about eye color or pain. This is a channel that asks the questions nobody else is asking about who you are. And this series is only just beginning. Now, an important clarification. This research is real. Correlations are documented, but correlation is not a life sentence. Eye color is one variable among many. People with light eyes can absolutely have high pain tolerance. People with dark eyes can absolutely be highly sensitive to pain. Biology shapes tendencies. This does not determine destiny. What this research offers is not a label, it's a lens. A way of understanding why your experience might differ from the person beside you. A way of having a more informed conversation with a medical professional. A way of extending yourself a little more patience when your body reacts more intensely than you expected. If pain hits you harder, you are not broken. If anesthesia wears off faster, you are not weak. You are running a specific biological configuration that medicine is only beginning to understand.
Ow.
Let's come back to where we started, that operating room, that anesthesiologist with a checklist. Some hospitals have now begun incorporating eye color as a soft indicator when calibrating anesthetic dosages. Not as the deciding factor, but as a signal worth noting. A small acknowledgement that the body on that table has its own specific chemistry, and that chemistry deserves to be taken seriously. It's a small shift. But in medicine, small shifts in understanding can mean the difference between a patient who wakes up in pain and one who doesn't. Your eye color is not decoration. It is data. Data about your ancestors, your evolutionary history, your neurochemistry, and yes, how your brain is likely to experience pain, stress, and the full range of physical sensation. So the next time someone dismisses your pain, the next time a standard dose doesn't feel standard to you, the next time you wonder why your body seems to process sensation differently from everyone around you, remember this. You are not imagining it. You are not exaggerating it. You're experiencing it through a nervous system shaped over thousands of years and encoded in the color of your eyes. That is not weakness. That is evolution doing exactly what it was designed to do. Send this video to someone whose pain has never been taken seriously. Maybe this is exactly the information they needed. And if the connection between eye color and the nervous system surprised you, the next video will take you somewhere even deeper. See you there?